Good afternoon. My name is Dr. Haver. I'm one of the pediatric pulmonologists at Boston Children's Hospital, and I wanted to welcome you to this town hall meeting for pulmonary patients and families. This pandemic has challenged all of us in many different ways. I'm encouraged by the resiliency I see around me and remain not just optimistic about our future, but confident we will emerge together stronger with the lessons that we've learned. I count myself as fortunate to work with colleagues who rose to the challenge, never lost sight of our mission to care for patients, continue to train the next generation of healthcare providers, and to engage in scientific inquiry to better prepare us for the future. We wanted to take this opportunity to provide you with some updates. We'll begin with a message from Dr. Raby, our division chief. Next, we'll give you an overview of COVID and some recommendations for managing respiratory diseases during the pandemic. Knowing the impact this can have on mental health, we'll then turn our attention to wellness and coping. And then you'll hear about options for both live and virtual visits. We'll conclude the program with the panel's response to questions that you've submitted. To begin the program, it's my great pleasure to introduce Dr. Raby, our division chief. He's the Lila and Irving Perlmutter Professor of Pediatrics at Harvard Medical School. Not only the chief of our division, but he's also the director of the Pulmonary Genetics Center at the Brigham and Women's Hospital. His strong, thoughtful, and compassionate leadership has been a guiding force for our patients and every member of our division. So I'll now turn the program over to Dr. Raby.
I just want to welcome everybody. My name is Benjamin Raby. I'm the chief of the Division of Pulmonary Medicine at Boston Children's Hospital. I've been in the role for 2 years now, and some of you may know me. I've tried to come through the clinics on an intermittent basis to meet people. So for those of you who I've met before, it's nice to see you again. And for those who I haven't met yet, I hope to do so in the future. I'm only going to speak very briefly and just to address two issues. One is, why hold this pulmonary town hall at all, and really why do it now? And I think there are four driving motivators here. COVID-19 is really new for all of us, and there are a lot of questions around it with respect to what COVID is, how it's affecting us, what we can do to protect ourselves. And unfortunately, a lot of what's out there in the lay media is an absolute mess. It's much more focused on some of the hype around the issue and some of the political controversies, rather than really trying to inform people on what should be the best course of action. Of course, now is a very good time to hold a meeting like this because school is coming up and there are a lot of questions around that as well. And we understand that particularly for our patients, given that this is a virus that gets into the body through the lungs and affects the lungs, that for our patient population, this is of special concern. So fortunately, we think that we have some informed answers for you. And one of the most important things is that we now have about 5 months of experience, both personally for our patients and for what we're seeing here in Boston, and also from the medical literature and the experience of physicians around the world. We are not going to be hyping any particular approach here. We're going to be giving you the facts of where things stand. And we hope that that will be an important reference for you and be able to ground things for you moving forward. As a division, it's one of our essential missions to make sure that our patients are educated about the issues related to lung health and their care. And so we felt that this was really important to do for all of you. And really what we want to do over the next little while is, while giving you some facts that are not so pleasant, to really be able to reassure you for the most part that we are here for you and that we can get through this next few months and for as long as we need to be dealing with COVID. So with that, I don't want to take up too much more time, but I do want to emphasize some of the major take-home points that I think you will hear throughout the discussion today. The first one is that the overwhelming majority of children have done exceptionally well during the first wave of the pandemic. And there have been a very, very small number of children who have had severe lung disease or complications in general. And this also applies to our patient population. We've been keeping track of all of our patients, and I can say that what I'm saying holds true for them as well. The second point is that if we follow the rules, it helps. If we wear masks, if we maintain social distancing, and if we pay attention to hand washing, it really goes a long way to preventing contracting COVID-19. But equally important for all of you is that maintaining very good control of your underlying lung condition is one of the best things that you can do to prevent the complications if you happen to get infected with COVID-19. We want to make sure that our patients are taking their medications and taking them properly, that people who need to do airway clearance, chest PT, are compliant with that people are getting exercise and maintaining physical activity if they can. And all of that is essential to putting us all in the best position to be able to confront this infection if we happen to get it. Equally importantly, your wellness, and this is coming from a lung doctor and a lung division, but your wellness is more than just your lungs, okay? Making sure that you're getting your education, making sure that you're maintaining some social interactions, that you're developing coping mechanisms to deal with all of the stresses around this are really important in staying healthy, and that's really important for us to convey to you. And lastly, we are here for you. We are here for you both to help you with COVID-related questions and issues, and more importantly, for your underlying lung conditions as well. And we can do this both in person and virtually, and you'll see towards the end that we've gone to great lengths to make the experience when patients are seen as safe and as usual as possible. So with that, I'm going to pass over to Dr. Sawicki, who will begin with the first of 4 presentations. I hope you really enjoy this and find it informative.
Good afternoon, and thanks for joining us. And as Dr. Raby said, we're going to be going through a series of presentations related to the COVID pandemic, specifically around what is coronavirus, how it has impacted children thus far, what our clinical experience has been, both here in the state as well as at Boston Children's Hospital. And then our panel will also answer some questions that were sent in prior to this webinar that cover many of the topics that I think must be on the minds of a lot of parents or those living with any chronic respiratory or pulmonary condition. So just to ground all of us, I'll start by just, again, showing you a schematic of what the coronavirus is. Coronavirus got its name from the word corona, meaning crown in Latin. And basically it's because the proteins on the surface of this virus appear like crowns in this picture. And these are the so-called spike proteins, which help the virus get in and invade different parts of the body, and in particular, enter into the human body via the airways and pulmonary system. Other names that you'll hear for the same virus include SARS-CoV-2 or COVID-19. And in general, when we say COVID-19, we're talking about the disease that results from an infection with this coronavirus. So what we've learned thus far in the pandemic is a little bit about how COVID-19 is actually spread. And it's thought that primarily this virus is spread from what's called person-to-person contact, and mainly through a route called droplet. This is because people who are in close contact with one another, within approximately 6 feet of each other, are at higher risk of spreading the virus between each other. And this virus is spread through respiratory droplets. And these are droplets that are produced when anybody coughs, sneezes, or talks, among other things. And when a droplet leaves someone's mouth, they can land in the mouths or noses of other people, and particularly on people who are nearby. So when recommendations have been coming out from public health authorities around social distancing and avoiding large gatherings, this is primarily to reduce the exposure that is potentially there from droplets. There have been recent studies, and these have been also mentioned in the media, around asymptomatic spread. And although we don't know all the answers right now, there are some studies that suggest that COVID-19 may still be spread by people even if they're not showing any symptoms. Again, underlying the importance of some of the mitigation measures and prevention measures. And these measures are listed here on this slide. And I think it's important that we continue to practice these infection prevention and control measures as much as possible. And these include hand washing and being very diligent both with yourself and teaching your children how to maintain appropriate hand washing for a minimum of 20 seconds when performing hand washing techniques. We hear a lot about social distancing and the recommendation of putting 6 feet of distance between yourself and those, particularly those who don't live in your immediate household. We now know that using masks or any kind of face covering, including cloth masks, can reduce both the spread of droplets and the spread of infection. And so covering your nose and mouth with a cloth face cover when around others is a very important mitigation measure. Being vigilant around cleaning and disinfecting surfaces, particularly in your home, particularly if others have been in the home, does make sense. This also is something that's going to be taken up when we think about how we are approaching our inpatient and outpatient clinical spaces. The encouragement to stay at home as much as possible is still in effect, but particularly avoiding large gatherings and avoiding any unnecessary or unneeded travel. And most importantly, monitoring health and monitoring symptoms, and understanding that if any symptoms do arise, that is the time to both stay at home, but also contact any healthcare professionals for further advice. So what are the symptoms of COVID-19? In general, this is a list of symptoms that have been reported among both children and adults who have developed COVID-19 infection. Not everybody who develops COVID-19 will have all of these symptoms, and many will only have 1 or 2, or in fact, very minor symptoms in this list. But generally speaking, symptoms of the infection include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, a loss of taste or smell sensations, sore throats, congestion or runny nose, nausea or vomiting, and diarrhea. And as you can see, these are quite common symptoms for other viral infections, and also some of these symptoms, particularly for children with respiratory diseases such as asthma, may be a sign of asthma, allergies, or other common symptoms that you or your child may already be prone to because of their underlying condition. So thus, if these symptoms do develop, it is important to realize that they may be a sign of infection, but they may also be a sign of something else underlying, which is why, again, partnering with your local pediatricians or any of your doctors here in the pulmonary division to understand and think about whether testing or other procedures need to be done is important. We've learned that the symptoms of COVID-19 are quite similar in children and adults. And in general, both here in the United States as well as internationally, children with confirmed COVID-19 seem to have in general presented with a milder set of symptoms on average. As physicians, we think about illness severity in a couple of different ways. And this particular slide points out 2 things that we as physicians look for when we're evaluating COVID-19 infections. One includes the symptoms, and as expected, going from mild to more severe disease means you have more symptoms. So a person with mild COVID-19 may only have a fever, cough, sore throat, and fatigue, sort of flu-like symptoms for many people. Once we start seeing respiratory symptoms, including shortness of breath or rapid breathing, this is a sign of disease that is progressing and getting worse and often requires further medical attention. Oxygen levels, which are an important marker of respiratory health, are generally normal in those without symptoms or those with only mild disease. They also remain relatively normal, although maybe a little bit decreased in those with moderate disease. And those with more severe disease often require treatment with oxygen, and that often necessitates hospitalization. So if there is a suspected case of COVID-19, we know that there has been an uptick in the number and availability of tests, both locally as well as throughout our state. At Boston Children's Hospital, we do offer and have the ability to do testing for both viral tests as well as antibody tests. The important thing to note is that there are 2 different types of tests. More broadly speaking, the viral test, which is the so-called nasal swab, which requires a nasal swab to do the test, is the one that will tell you if you or your child has a current infection. An antibody test, which is actually a blood test, is not going to diagnose an active or an acute infection, but will tell you potentially if you had had a past infection. However, an antibody test may take several weeks to show the development of antibodies, because that's how long it may take your body to make antibodies had you had a prior infection. And more importantly, we're not sure yet what having antibodies to COVID-19 means in terms of understanding whether or not you are protected for further infection or further symptoms. Therefore, we currently do not recommend routine antibody testing for most kids, but for kids and or adults who are presenting with symptoms that might be concerning for COVID-19, a viral test or a nasal swab is still the recommendation. If a child or adult is diagnosed with COVID-19, what are the current available treatments? In terms of children, the vast majority of children with COVID-19, both here in our state and our hospital, as well as internationally, are able to be treated as outpatients based on their symptoms alone. These treatments include treatments such as Tylenol to reduce fever, bronchodilators such as albuterol, which may improve cough, particularly in those who have conditions that are responsive to albuterol, such as asthma, cystic fibrosis, or some other chronic respiratory conditions. Symptomatic care is also important to avoid dehydration and other complications from any viral illness. And some patients may respond and have treatments that include steroids. And this is particularly true for those with conditions such as asthma, and will be discussed later on. We've learned that most people with COVID-19 end up not needing hospitalization, and this has been particularly true for children with this infection. Currently, there are no outpatient antiviral specific therapies that are available at this point, and no preventive therapies for COVID-19 have yet to be identified. We hear a lot about vaccines, and vaccine development is ongoing throughout the country and throughout the world. However, at this time, a vaccine may not be available for quite some time. This is data from the state of Massachusetts. If anyone is interested, this is publicly reported data on the Massachusetts website that you can find and is updated on a regular basis. As you can see, in our state, the average age of the confirmed cases is 51. And what you can see in the light blue bar is that there have been just over 6,000 cases in individuals under the age of 20 throughout the state. And if we look at it, the rate per 100,000 people, that is the lowest in terms of any age group that is studied or seen. So although we are seeing cases in kids, the case rate is much, much lower than in older adults. And then when we look at hospitalizations and hospitalization rates, we see the same trend. The average age of those hospitalized in the state of Massachusetts with COVID-19 infection is 68. There have only been 111 hospitalizations of children under the age of 20 in the state of Massachusetts up through this past week. And the rate per 100,000, as you can see, is quite low. Of note, there have also been no deaths of any children with COVID-19 in the state of Massachusetts reported. There's lots of information out there on the internet, as well as through different various medical sources. Boston Children's Hospital on their website has an entire page dedicated to COVID-19 infections that includes more information about symptoms, testing, and treatments. Internationally and nationally, there's information from the World Health Organization and the Centers for Disease Control that has helpful tips and hints, as well as information around risk mitigation, treatments, as well as symptoms to look out for. And the American Academy of Pediatrics has also put out information, some of it related to symptoms and treatments, others related to some of the considerations when we think about going back to school, camps, or other activities. And with that, I'm going to turn this over to my colleague, Dr. Gaffin.
Thanks, Greg. So I'm John Gaffin. I'm going to take over and talk about how COVID-19 may affect some children with chronic respiratory diseases. I'm going to start by just sharing that the CDC has been continually updating a list of underlying conditions that may lead to increased risk for severe COVID infections. And this is for all ages. What I'm sharing with you is not their complete list, but some selected items that may relate to our patient population. And so those that are characterized with at-risk conditions where there's fairly strong evidence that, that they may be at higher risk are children who are medically complex, who have neurologic, genetic, metabolic conditions or congenital heart disease, and those who are immunocompromised from an organ transplant. And those that might be at risk on the right-hand side of the slide, these are groups where the evidence is mixed and it's not as strong to indicate that there's a risk there. But it includes moderate to severe asthma, cystic fibrosis, pulmonary fibrosis, smoking, and other forms of immunocompromised states. And then there's very limited evidence to suggest that that other chronic lung diseases pose this risk. And this is available from the CDC, and it is covering all ages, not completely specific to children. When we think about the kids that we take care of, the reason to have some concern that children might be at higher risk if they have underlying lung conditions is just mostly based on the notion that if you already have some either injury or underlying respiratory process, that having a viral infection on top of that may be harder to recover from and harder to handle when it's happening. And what I'd like to do in the next several slides is to discuss what we know so far about how some of the more common underlying respiratory conditions that we take care of may be affected by COVID-19. And those include asthma, cystic fibrosis, interstitial lung disease, chronic lung disease of prematurity, which is also called bronchopulmonary dysplasia, or BPD. And though not an underlying lung disease per se, I want to touch on smoking and vaping because I think that's an important topic for this risk conversation. And I'd also talk a little bit about using steroids specifically for asthma, since this was somewhat of a debate when COVID first started. So the first question I'll pose to myself is asthma a risk factor for severe COVID-19? And initially there was a concern because we know that in non-pandemic coronavirus infections, so outside of prior to COVID, children with asthma were certainly at higher risk for more severe illnesses. But the experience so far has been much more reassuring. The case series from China that included adults and kids did not specifically identify asthma as one of the bigger risk factors for COVID severity. There was a recent report that was just published on almost 600 children from across Europe who had tested positive for COVID, and only 16 patients, which was out of 145 with underlying medical conditions, had asthma. That's very few. And there have been 2 studies published from the United States that have even suggested that patients with asthma or patients with asthma who are on inhaled steroids might have fewer receptors in the lung tissue for COVID-19 to attach to. So some mechanistic data that might explain why we haven't seen a lot of patients with asthma and severe COVID. On the flip side, we also wonder, could COVID-19 be a risk factor for an asthma exacerbation? And again, initially we had very high level of concerns because patients with asthma are most frequently triggered by viral-induced respiratory exacerbations. And from pre-COVID coronavirus information, we know that that infection rate is about 3 to 5% of all the viral infections that go around in the wintertime that affect our patients. But across the US and in Europe and elsewhere, the experience has been, again, very reassuring. We've seen, again, across these different areas that about 70 to 80%, there's been about 70 to 80% fewer pediatric emergency department visits for asthma over the same time this year compared to previous years. So a huge reduction in asthma exacerbations at the same time that COVID is increasing. Now, I want to touch on the inhaled steroid question, or the steroid question, and whether taking these medications for asthma is safe during the pandemic. And this was raised very early on as a potential risk because there's some older data that if you have severe COVID infection and are hospitalized, and in previous epidemics, that if you had received high doses of steroids through an IV, that you may have more side effects and may have worse outcomes, which is very different than how we use it for patients with asthma. And overall, we know that the benefit of inhaled steroids is extremely high in the primary control of the disease process, in its benefit even when there's viral infections. We use inhaled steroids, or prednisone, which is a systemic steroid to treat these the infection-related asthma exacerbations. And we know that these medications decrease the emergency room visits and hospitalizations in patients with asthma and actually prevent them from needing the higher dose of steroids over time. And because of this risk-benefit relationship and the strong benefits that we know, every major asthma-related health agency has been recommending continuing control of medications for asthma, as do we across the board. And that when needed, taking bursts of steroids like prednisone for asthma exacerbations is absolutely appropriate. And even more recently, when you've looked at information about could asthma be a risk factor for severe COVID, it seems more likely that if it's uncontrolled, then it may be more of a risk factor. And so that's why we really emphasize keeping control of our asthma patients' underlying condition. I'll touch a little bit on some of the other chronic respiratory conditions that we see in our patient population. For cystic fibrosis, there was a multinational registry study across 8 countries, and it found only 40 CF patients were infected. And they overall had a great prognosis, even among 11 patients who had received lung transplants. And more recently, there's been US data that's identified 81 confirmed cases. 23 of them were pediatric. Only about a third of them were hospitalized, and the vast majority have done well. Chronic lung disease of prematurity, or bronchopulmonary dysplasia, there's very little information about this population. And even in that largest European study that I mentioned before, only 6 of those patients were patients who had BPD. Our own BPD population at Children's, which is several hundred, we've really not seen any significant concerns. However, there has been more of a concern that young children, those under a year old, have been overly represented in those who come to the emergency room and may need hospitalization. And so we're definitely being thoughtful and cautious that the children who are very young with BPD and the infants with BPD may have higher risk that we just haven't seen. Children with interstitial lung diseases, or ILD, there's really been no specific evidence discussing their specific risk for poor outcomes with COVID. There have been a few cases nationwide, and they've all done very well. So that's also very reassuring. I want to touch on smoking and vaping, because if you remember back to last summer and the year prior, that this was really a big concern for especially in our adolescent population. And from a physical standpoint, we know that cigarette smoking and nicotine increases the types of cells in the lungs that COVID infects. And these are, you may have heard of them, they have the ACE2 receptor on them. And while there's not direct evidence that smoking definitely leads to worse outcomes, there's a lot of speculation that high rates of smoking or vaping in the young adult population may be their predominant risk factor, as opposed to old age or diabetes or some of the other factors that are affecting the elderly population. That this may be one of the risk factors that's leading to an uptick in that age group having more significant COVID-related illness. But we still need to see more data to be convinced about this. And I just want to say that we are continuing to monitor these trends. As you've heard, that there's relatively low numbers of children with COVID infections, and especially severe infections, which is just great news. And that also applies to children with underlying respiratory conditions. And we know that our patients are doing a really good job of social distancing, and that some of the low numbers may be just that they're not being exposed. So we're continuing to watch these trends over time and update our approach as we learn if there's anything new in terms of increasing risk factors. So the clinical approach that we're taking is to stay vigilant. First and foremost, we'll try to advise everybody to do their best to avoid getting infected. Dr. Sawicki mentioned how to do this by following the CDC guidelines. And I'll really harp on these items on the right side of our screen, which is achieving optimal disease control for whatever the underlying respiratory condition is. It's really important to adhere to the preventative medical treatments, avoid respiratory triggers and irritants where you can. And these things can be items like smoking, allergen exposure, toxic cleaning products if you're in the vicinity, and stress and anxiety for many patients can be a trigger of their respiratory symptoms as well. And if you're concerned that you or your child does not have your underlying respiratory condition under good control, then please reach out because that's really a priority in making sure that if we encounter the infection, we're able to really weather it well. And then if you feel like you or your child is sick, we recommend you keep your child home from activities, follow the CDC guidelines for quarantine and isolation, follow the sick plan that you've come up with your provider, and contact us for any questions. And we would absolutely like to be involved in making sure that our patients are doing well, even if they do get sick. With that, I'll turn it over to my colleague, Carolyn Snell, who will talk about the mental health approaches.
Hello, everyone. I'm Carolyn Snell. I'm a psychologist with the Pulmonary Division, as well as with the Department of Psychiatry at Boston Children's, and am happy to be speaking with you all today about mental health, wellness, and coping during COVID-19. I wanted to echo what some of the previous speakers said just to start, that I think from a mental health perspective, this is also a great time for us to be having this webinar. In addition to all of the experience and data that the medical providers are bringing to the table after 5 months of experience, there's also a changing nature of some of the impact of this pandemic from a mental health perspective and for child wellness. And so I think this is a great time to be talking about some of the effects of chronic social distancing and some of the greater isolation that families have been dealing with. So I wanted to begin with just talking about some very common and normal emotional reactions to pandemics and to social distancing and quarantine. These come from studies both of past pandemics across the world and also a couple of studies that do exist from Italy and from China in terms of the mental health impacts of COVID-19 specifically. These are, it's worth noting, impacts on adults. And so studies found that people reported a lot of worry and fear and sometimes a social avoidance that lasted beyond the pandemic. People talked about feeling lonely and sad, perhaps feeling bored, increased feelings of irritability, and in some cases, some trauma reactions from people on another end of the spectrum. And for children, we see a lot of the same types of emotions with slightly different manifestations. And so particularly for young kids, I just wanted to review the ways that some of these things might present. So sometimes rather than seeming overtly, sad or distressed, kids may be more returning to outgrown behaviors or may more show their distress through other means, such as increased sleep difficulties, increased somatic symptoms, meaning like stomach aches or headaches or kind of physical stress. And certainly if a child is avoiding activities they previously enjoyed, it's a common reaction, but certainly something that I'm going to be talking about how to help with. And then finally, this irritability and acting out, I've heard from many parents of kids that we see that they're seeing some of those emotional reactions in their kids. And of course, those things can be from multiple factors, right? And some things that may seem behavioral may also be, due to emotional distress of isolation. So I wanted to share some ideas for self-care and coping, both for parents and of course for children, as we are all going through this experience. The first thing that I really wanted to emphasize is both in talking with children about this and for ourselves as adults, really emphasizing controlling what we can. And there is a lot that we can control in terms of maximizing health and mental health. And so, number one, prioritizing sleep and keeping a consistent daily schedule with things like sleep, good nutrition, of course, keeping up things like infection control that are going to be good for one's physical health. And as much of a normal routine as possible in the constraints of the world that we're living in at the moment. Another major recommendation that I've been giving to families whom I work with is to really be mindful of media consumption. It can really feel as though it's the 24/7 COVID-19 channel sometimes. And so, you know, thinking about perhaps limiting media exposure to certain news sources and others, and have listed some really nice reliable ones, such as the Center for Disease Control and the World Health Organization. As well as your own medical team. And another idea for that is really just picking a couple of sources or a certain time of day, and otherwise shutting off media, particularly if you're finding that it's causing stress for you or for your child. Some other thoughts would include drawing upon things that have gotten you through other difficult times with your child, other setbacks or other times that they weren't able to do everything that they wanted to do for whatever reason. Very much in the face of some of the loneliness and the social distancing with COVID-19, I'm encouraging everyone to, of course, seek support, virtual or not, from friends and family to combat some of those things. And certainly to take time outdoors each day, to pay attention to those kind of basic wellness things, you know, doing something active each day if possible. I would also encourage everyone to increase or to try out some type of relaxation practice. There are some wonderful apps out there, such as Headspace and Calm, many of which are free if relaxation practice is something that you might be new to, but it's something that can be very helpful during these types of stressful times. And then finally, if your child or if you have a mental health provider or want to see one, you know, connecting with that person. And I would also want to echo that, you know, reach out to your health team about these things, because we want to be there to support you from a wellness perspective. I wanted to put this up as just an example of all of the different types of self-care that we may engage in. And the idea here is certainly not to overwhelm and to have people be thinking about all of these things that they should be doing. We're all very busy and under a lot of stress with the pandemic, but more to give ideas and also to help highlight what people are already doing. Because I suspect that for many people looking at this list, you may see some things you're already doing and some things that you might be interested in trying. This is a time where practicing and modeling self-care for our children is really critical. And sometimes for parents, I think self-care can really feel like the last priority at the moment, as so much is going on. And particularly for those who had to be educators as well as working parents, or educators as well as parents at home. And so in talking with children about this, there are some great resources, one of which I'm just displaying on the right. And in response to one of the questions, I'll speak about this a little bit more, but you know, I've been really encouraging parents to, you know, set boundaries and with their own time, and really be okay with saying no to obligations and modeling that perhaps for kids and teens in some situations as well. And then finally, in terms of self-care, a lot of us are experiencing a lot of anxiety. And so using distractions, using self-soothing activities can be very helpful with those feelings as well. Something that can be really nice to reflect on as well in the moment is what kind of strengths, either in perhaps yourselves as parents or in your children and teens, might you be seeing that have come out during this pandemic. And so, for example, you know, you might notice, you know, courage in your child, might see, you know, sense of humor, all of these types of things that are strengths that can really help during this time. Finally, I just wanted to spend a minute or two speaking about communicating with children about COVID-19 and reentry planning, since this is a very common question that a lot of us get. So the first thing that I would emphasize about that is really following one's child's lead. So asking them what their questions and concerns are. Some children want to know a lot of information, other kids just want to know what they need to know. And when giving that information, it's very important to certainly be reassuring and be clear. And so balancing those two things, right? We want to be realistic and honest, and at the same time, not be alarming to our children. And so it's okay to say, I don't know, in some circumstances as well, right? That children may ask questions, and these are things that we're learning over time, or that we don't know because schools haven't announced exactly what they're doing. And it's okay to say that as well. Certainly, I would encourage people just to validate what their kids are feeling, meaning giving examples of what are some typical emotional reactions, perhaps what you as a parent may have been experiencing, and helping problem solve with your child together around some of the things they may be concerned about, such as not being able to see friends. Perhaps there are ways to safely do that you could think through with your child, or perhaps virtual is the answer. And I would encourage as well for kids really emphasizing what they can do. As others have said, probably you all in the audience are very good at social distancing and hand hygiene and all of these things because of your children's conditions. And so those are strengths that you all bring to the table, and that you really know how to do this and manage these things, and any other strengths that your child is bringing to this as well. Reassuring children that worrying is normal, that COVID-19, it tends to be mild in children, and then some of the other information that our other presenters have been sharing. And then finally, just speaking about supporting children with anxiety and with feelings of loneliness. Again, helping children to enhance their feelings of control when they become fearful, encouraging them to video chat and reach out to others. Encouraging also, watching good news segments, or perhaps things that are humorous and sort of lighten the mood at home can be really helpful with some of those feelings as well. Letting children know that it's okay for them to feel stressed. It can be very distressing for parents to hear that their children are feeling lonely, and those sorts of things, and yet those are normal feelings on some level, and letting kids know that, and reassuring them that doctors and others are working on this, and that this will be a temporary situation. So with that, I will turn it back over.
Well, thank you all for being here, and thank you to my colleagues for those wonderful talks. I'm going to talk a little bit about what the experience of coming to pulmonary in the post-COVID era is like, because things have certainly changed, just as they've changed in all the other areas of our lives. So we're going to focus on when is it best to come in for a visit, and when should we have a virtual visit, as we've certainly ramped up our capability to do both. So throughout this time, pulmonary has remained open. We have been seeing patients continually in clinic. During the initial shutdown, we focused really on emergent or urgent situations where we needed to see patients, and we did have a pretty drastic reduction in who we saw in person. But at the same time, we quickly ramped up the ability to see patients with virtual visits, and that program has been really successful and really well supported throughout the hospital. We kept our lung function lab open, and we're continuing to do lung function testing, but obviously with significant precautions. We did briefly have our sweat testing lab closed, but that is now back open. And then really starting in June, we started to open slowly. Again, throughout the hospital, there was a really thoughtful and gradual approach to how we could do this safely for our patients, but make sure that we were able to provide the care that was needed. So you can see just throughout June, we did have a steady increase in who we were seeing in person. And that has continued to climb as we've increased our availability in July. We are limited in our in-person capacity, just because we've really had to institute good distancing measures and limitations on how many patients we can see in the clinic at any given time. We're really trying to get patients into their exam rooms immediately upon arrival and minimize any waiting time. And initially we were prioritizing those who needed to come in for testing or those who were new to our practice, but we are continuing to expand that as time goes on. There have been some changes, as I mentioned. So again, the distancing has been really key. We are trying to maintain as much distancing as possible within clinic, both in terms of the number of providers that we have present physically, but also making sure we minimize interaction between patients and other families. So again, we are trying to get patients directly placed into the room. We have you call us when you arrive before coming up to the clinic so we can make sure the room is ready for you. And we talk daily in the morning to make sure we know what precautions are needed and are in place and ready for the patients to come in. The other change many of you may have seen is that now all testing does require a scheduled appointment. So gone are the days where we could see you in clinic and send you right down to the lab without calling first. Everything has to be scheduled. So whether it's a lab visit or an imaging study with radiology, or even lung function testing, we have to make appointments for all of that. And again, it's for safety to really make sure that the location is ready for you when you arrive and that you can be seen right away. But that has required a fair amount of coordination, as I'm sure some of you are aware. And we've really taken great measures to make sure we can coordinate all of those things when you come in for your visit. Throughout the hospital, there is a pre-visit symptom screening process, and so you will likely be asked the same questions several times prior to your visit. Again, this is important, and I'll talk about those questions a little bit more. But all of this, may result in more than just one phone call to set up a visit, and I think at times that can be challenging, but especially when you have so much else on your plate. But again, recognize we're really trying to maximize safety and get your children the care that they need. When you come in, you will see some changes. We have some new signage to, again, maximize that distancing, but we also are minimizing the time spent at the check-in or check-out window, as we're trying to do as much of that remotely as possible. And so I think you will find that your experience is quite different than it used to be. We don't have patients waiting for their rooms, and patients come in, get seen, and then head on their way. We are also open in all of the satellites now, and are able to see patients in person as well as with virtual visits, but for Lexington, North Dartmouth, Peabody, Waltham, Norwood, and Weymouth. Again, the availability, there are fewer appointment slots, again, to take into account all the same precautions that we're doing in Boston, but there should be availability to see patients there. And all of those sites also have availability for lab work and imaging, which also still needs to be scheduled. We are not currently doing lung function testing at those satellites, but again, that can be easily arranged. We are doing lung function testing in Weymouth and Boston. So the screening questions have evolved over this time as more has been learned about the virus. So this is the current screening question, and these are the same questions that we all answer when we come into work at the hospital, asking if we've had any fever, cough, sore throat, muscle aches, difficulty breathing, chills, or new onset of loss of taste or smell. And then whether there's been any contact with a household member who tested positive in the last 14 days. And these questions are just incredibly important, not because we'll turn you away and say we can't see you, but because we need to plan for the appropriate precautions and just be ready, again, for safety of your visit. So which type of visit is best? So when we think about what can we do with an in-person visit, in particular, the first time we meet you, it's great to be in person and really establish rapport. All of our Zoom meetings and time with the computer, it's just not the same as meeting someone face-to-face. The measurements that we can obtain that often are really helpful as we monitor your children's progress is the weight, height, and as well as the vital signs, including an oxygen level and heart rate and respiratory rate. Our physical exam is extremely important to listen to lung sounds, as well as examine the nose and the mouth and look at the fingers. And then we often will coordinate testing, as I mentioned. So whether it's the lung function testing that's so important for many of our patients, or obtaining blood work or imaging. On the flip side, our virtual visits can be really helpful in terms of saving travel time. We have more limitations in terms of the measurements, but there's some good guidance on how to obtain an accurate weight at home, and that can be helpful. Our physical exam is similarly limited, but we can assess some things through the virtual visit, particularly work of breathing. And it allows us a new opportunity to see home medications, to see equipment that you might have in the home, and really troubleshoot any issues with those things. We also can coordinate these visits with nutrition and social work, who currently are still primarily remote or virtual. And so we can make sure that you're seeing all the different providers that you need to see for your visit. There's also this option for a hybrid type of visit where you could get your testing done either in Boston or in a satellite, and then have a virtual visit with the provider to review results. And many providers have found this to be very successful along the way. So in terms of, when should we have an in-person visit? When should it be virtual? So these are just a few examples, and there are many more, which we'd be happy to talk through with you more. But if your child routinely performs lung function testing, and that testing really helps guide our management, then an in-person visit would really be most helpful. If they need additional testing that we know of, such as blood work or imaging studies, and often coordinating those studies with the visit can be helpful. Or if your child is sick and they're prone to having abnormal sounds on their exam, wheezing or crackles, or we need to know an oxygen saturation, then it might be most helpful for you to come in and be seen in person so we can listen to your lungs. But on the flip side, if your child has been doing well, as we've seen with many children throughout the last few months, and you just need to review their treatment plan or talk about medication refills or get forms ready for school, such as your asthma action plan, these things can all be done easily with a virtual visit. Other situations where coming in may really pose a significant burden due to the difficulties with transportation or equipment, again, a virtual visit often is a great first step. Or if you just have more questions, specific to your child and what their risks may be, or want to talk more about school or jobs, those certainly can also be done with a virtual visit. So some tips to maximize your experience with the virtual visit. Again, if you have your medications nearby, it makes it really nice for us to see them and review them with you. If you could start the visit or plan to have your child present for some part of the visit, it is helpful for us to see them, but they don't need to be there for the whole visit. If they want to go off and play or go have a snack, whatever it is that gives you that time for discussion, that can also be helpful. If you sign up for the My Children's portal, this can allow us to share documents with you. You can see the document from the visit, and also we can share things like the asthma action plan with you through the portal, and that can be particularly helpful after a virtual visit. It is helpful if you log on early, allow extra time for any technical difficulties. The IT support for virtual visits has been incredible throughout this time, but allowing that extra time is very helpful. And then if your child has been in to see any other providers, if they've seen their pediatrician and you have a recent weight or any recent measurements, those can also be helpful to inform our visit with you in the virtual setting. We recently surveyed about 70 patients who had virtual pulmonary visits over the last couple of months, and the results have been really encouraging. So in terms of satisfaction, almost 80% of those that we surveyed reported a high level of satisfaction with their virtual visit, and even more so with convenience. Over 90% rated the convenience at the highest level. So I think we are going to have to continue with virtual visits to some extent, and I think they are going to find their place in how we practice and remain helpful in some situations. On the flip side, the in-person visits, we are asking patients to bring in a spacer and inhalers if you have them, in an attempt to avoid giving nebulized treatments in clinic. If you bring your inhaler, we can review it with you. It's really important to make sure that any anticipated blood work or imaging or lung function testing is all scheduled in advance, again, to make that visit go as smoothly as possible. We do ask that you wear your mask, wash your hands frequently. As much as you can prepare your child for them wearing their mask, again helps the visit go smoothly. Your providers will all be wearing masks, and in the setting where a child can't wear a mask, then you'll also find that your provider is wearing eye protection. So that is another change. We are currently limiting the number of people who can come to the visit, so up to 2 adults and no additional children if possible. Again, we understand some situations require, that you can't stick to this, but as much as possible, again, to facilitate that safety, we're asking that you limit the number of people who come. And again, signing up for the portal can be very helpful. You can check in online if you are enrolled in the portal, and that again can facilitate the convenience of your visit. So if you're still at the end of the day not sure which type of visit is best, what to do, we are happy to talk about that with you. You can reach out by phone or send a message through the portal, and we can certainly troubleshoot. Often we'll start with a virtual visit if you think that would be helpful, and then decide what testing is needed, or we can certainly plan to bring you in if that's what works better for you and what we think works best for your child. And just one last plug for the portal, if you're sensing a theme here, this is the website, the Boston Children's website, and there's this little spot up at the top to click on to sign up for the My Children's portal, and all it requires is that you have an email address. So I think with that, we are going to turn it over to some questions.
We got over 400 questions. So I just wanted to bring up some of them that came up very frequently. The first is the question about the masks. Do we need to use them every time we go outside? Do the kids need to wear them all day in school?
So I'll answer that. And there have been a couple of questions that have come up around sort of the potential, or is there a potential danger in having kids wear masks? So the recommendations, along with hand hygiene and social distancing, have been made fairly clear that mask wearing both protects the droplets from going from someone to another person. And so in large part, in addition to social distancing, mask wearing does prevent the droplet spread. And so if everybody is wearing a mask in an environment, the possible transmission is significantly reduced. And so if only some people are wearing masks and others are not, there is that risk that there is a asymptomatic or someone who is infected who is potentially able to transmit. And so the best precautions are for everyone to wear masks at all times, and particularly in places where they are unable to social distance, and particularly indoors. I know that we're going to talk about schools in a second, and I think a lot of people are waiting to hear what we say about schools. But I think when schools are going to be coming up with precautions, they will require often the use of masks for staff as well as students down to a certain age. I think it is recognized that younger kids may have more of a challenge with wearing masks. And this is something that I think can be modeled behavior. A lot of times kids will respond to having adults around them or other kids around them wearing masks. But for the youngest kids, certainly kids under 2, this is not really a recommendation that can often be followed. For sort of preschool age kids, there are different schools that will have probably different policies around that. But again, social distancing and mask wearing is still the linchpin of prevention of spread for older kids and adults. In terms of, are masks dangerous? A lot of our patients are comfortable wearing masks even pre-COVID. This was a recommendation for our individuals with cystic fibrosis to be wearing masks in healthcare facilities. And this predates anything from this pandemic. And it is very safe to have a mask on for periods of time. And there does not seem to be any reason to be concerned that wearing a mask, even for a couple hours at a time, will be of any detriment to anyone with a existing lung disease.
Okay, well, thank you. I think we should just address, it's coming up even right now, questions about returning to school. Is it safe?
Yeah, so I'm happy to talk a little bit about this. This is a very challenging question, and I know you all have many, many specific questions, and I think this is an opportunity to reach out to your provider. If you have questions specific to your child and your family situation, we're certainly happy to talk through that with you. in general, our general feeling is the majority of children are safe to return to school when schools feel it's safe to open. The data supports that the risk in children is low, and the risk for COVID-19. But we all know that viruses do spread in schools, but many of the precautions that are being put in place will likely help with that. The masks will help. There's a lot of questions about 6 feet versus 3 feet, and the masks are really help to prevent transmission in settings where people cannot be 6 feet apart. And I know that we are all faced with the same uncertainty as we haven't heard what schools are officially doing. And that's hard, but it also sounds like schools are going to be quite lenient for families that wish to keep their child home. They're going to allow that as an option. So we don't have a say definitively, for any specific disease that really should be out of school versus in school. At this point, we really are, support the decision of when it's safe for schools to open, it's safe for kids to go. But we recognize that individual families, individual children are going to have some specifics that we need to talk about whether or not it is safe for that child. So we're happy to do so.
Great. Another question that came up quite often is families saying, we've been home for months. My kids have not been able to see their friends. Seems to make them really sad. How do I know when it's just normal and when is it too sad?
Yeah, so I think that's a great question that I both want to try to answer specifically and then also just speak to that kind of group of questions that a lot of people had. Specifically, I mean, of course, we know that some of those feelings of loneliness are very normal, and it's healthy for kids to express it as much as it can be painful for us as adults to sometimes hear it. That said, of course, if you are seeing major changes in your child's behavior, if you're seeing your child become, very withdrawn, changes in their sleep and their eating, things of that nature, then I think those are signs that perhaps your child is struggling more and that might be a good time to perhaps reach out to your healthcare provider or other supports to help. I also just wanted to address that group of questions in general about sort of what is the balance between supporting children's mental health and development on the one hand and keeping them safe from a health and infection control perspective on the other, which again is such a challenging question overall. And wanted to give a couple of thoughts about that. So the first is, getting the facts for yourself as a parent and getting your questions answered, obviously really important, and we want to be available to try to answer some of those questions. But beyond that, I really want to empower families that this is about their judgment in terms of what situations they feel, safe bringing their child to and what their level of comfort is. And I would want to empower people to set boundaries with others, and if people aren't doing things that you're comfortable with around your child, and also very importantly, really setting expectations with children and with others going into situations, right? So if you are, for example, planning to have a socially distanced play date for a child or something like that, really talking with the other family involved beforehand and talking to your child beforehand about what to expect, what precautions need to be taken, and the plan for that overall, I think would be really important.
And I know as people registered, there were lots of questions about asthma. I think many of them were addressed, but there's one that we should try to respond to, which is, we've heard a lot about nebulizers being dangerous in terms of spreading the illness. If my child is being treated with a nebulizer at home, do you think it's safe?
That's a good question. So there is concern that if somebody has coronavirus in their lungs and airways and they're using a nebulizer, that the nebulizer may actually, dissipate and spread the virus out of the body, since it has some aerosolization to it, which is not the case for the inhalers that are the MDIs, the puffer inhalers that we have that we use with spacers. So you'll notice that if you've come to our clinic or even in our emergency room now, everyone is just switching to the inhalers as the safest option. There are some medications that just don't come in inhalers, and there are some patients where they truly are not, benefiting as much from an inhaler, and they feel like they need a nebulized therapy. And what we recommend in those cases is, if you were to use, a nebulizer for whichever medication, to try to do it in a way where either you're in a spot where the door can be closed, and then you can let the room, essentially once the nebulizer is completed, that the room has some time to sort of settle before other people go in there or wipe down. Some have even, gone out into a patio or an outdoor space where there will be less concentration of any droplets outside of the nebulization process as well. So primarily use the inhalers if you can, and if you need to use a nebulizer, to do it in an enclosed space, and then essentially wipe it down or keep the door shut afterwards for some period of time, maybe a half hour or so, just to let things, anything that's aerosolized.
And I think we have time for just one or two more, but there were several questions that came up about long-term effects. Do we know what's happened to the children who've had COVID, who've been infected, and what happens to them long-term?
Because this is a new condition, there isn't a lot of data yet available on the long-term consequences. We do have some data from some of the other viruses that are in the same family of coronaviruses, and most of those viruses are not associated with long-term problems in people with mild infections. And we think that that'll probably be true here as well, that most people who will get infected, that they will clear it, and long-term there won't be a problem. But it is possible that there will be a subset of people in which it will be. And there are studies that are going on now and studies that are getting underway, and we're planning on being a part of these to really look at the long-term effects and see whether or not there's anything that we need to be concerned about there. But again, it's a little too early to know. What we know from adults is that the vast majority of people, even those with pretty serious pneumonias, they end up clearing it well and feel pretty well a few weeks later without long-term problems. So we're keeping our fingers crossed with that.
Just add, Ken, to the school question, because many people asked about daycares and I didn't specifically address daycares, and daycares are in Massachusetts have been allowed to open, again with significant precautions and some changes in place. And again, the rates are so low in children, particularly children under 10. That's where the decision to open daycares really came from, is that being safe. That said, I still think everybody, we need to consider the individual child's underlying condition and think through that carefully, as we do know that kids in daycare get viruses and viruses do spread in daycares. But again, the majority of children with mild lung disease should be safe to attend daycare or school.
And I think that one important thing to emphasize here is that it's very confusing for people to hear some of the messages that we're trying to give. On the one hand, we're saying, COVID-19 is a serious thing and that we have to be careful. But on the other hand, the vast majority of people are going to be just fine, including the vast majority of kids, even those with underlying lung conditions. So it's a mixed message. And the reason it's a mixed message is that if we tell everybody there's no issue whatsoever, and you don't have anything to worry about, people are going to be pretty lax about the precautions that we need to do to protect the whole community, to protect everybody. But if people wear their masks, if people wash their hands, if people maintain social distancing, then the likelihood that there's going to be a problem for your particular child, even in the school setting, is very low. And so again, for the most high-risk patients, and those patients we want to talk to on an individual basis and develop some plans together. But with the exception of the most high-risk students, really everybody should feel that with the proper protections that they can go back to these things safely once the schools open up. And I have to say that I've been really impressed with the role that our local governments have played in this regard. They've been very responsible and mature about not reacting too quickly, but when they do, to make, you know, the messaging very clear that now's not a good time to be at school, now's not a time to have daycares open. And this gradual reentry process has been gone off very, very well. And our rates around the state have remained very, very low despite the reopening. So I think we can all have a lot of confidence that if schools do open up, that for the vast majority of people, this will go very well. And again, we just want you to all know that we're here to help address the individual situations and come up with strategies for your particular situation.
Matt, I just want to thank the panelists and for the audience for taking time. And again, if you have questions or particular concerns, please feel free to reach out to us, give us a call, and can certainly speak to your provider or any of the other people in our clinics. So thank you very much for your attention.